pai, how are we going, Tracy? Shall we start?
Yep, so we've got 24 at the moment and still admitting a few more as they come in. So yeah, I think so.
Okay, all right. Thank you very much, everybody. Thank you for your continued patience. And you know what? Thank you for being open to the Zoom life. Yeah, the Zoom life that we've all been living maybe over the last 2 years. So coming into the Zoom space, I'm going to offer up karakia to start our hui this morning. And hopefully you've all got the full agenda in front of you. So I'll give karakia and then I'll give some tikanga or some ways that the hui will run, and then we'll get going. So kia ora tātou, me inoi tātou. Manawa mai te mauri nuku, manawa mai te mauri rangi, ko te mauri kai au, he mauri tipua, ka pakaru mai te pō. He honore he karoria ki te atua, he maungarongo ki te whenua, he whakaro pai ki ngā tangata katoa. Amene. Ka pai, so sending out all the good vibes, all the blessings to everybody, all of that we need as we step into our Monday. So thank you all for being here. Tēnā tātou katoa. We do have a full agenda. It is my responsibility to let you know who I am. I am Kine Moaki. I do sit on the Waitakere Health Link board, and I do some of these things to support the work that we do. So facilitation is one of those, and it's my honour to hold space with you all today. In saying that, the space is so full today that I'm going to introduce you to Tracy. Tracy, put your hand up, please. Raise your virtual hand for us so you can show us what raising your virtual hand looks like. Oh, okay, thumbs up will do as well. Ka pai. So there's Tracy giving you the wave, And so Tracy is going to be in charge of our time. She is what we call our time taniwha, or our time keeper. That's a very important job. And I'm going like this because that's what it might feel like, okay, as we go through today. And that is so that we can honour everybody's time. So just being really upfront about that. Thank you, Tracy, for doing that. Tracy, tell us about how long everybody will have to have a kōrero.
Okay, so everyone's got 2 minutes. So I hope you've got your information prepared and start right from 1 second, so we don't waste any time. And I look forward to hearing everybody's information.
Yes, absolutely. And also please make use of the chat space, the chat box. If there's anything that you want to leave in there, we will download all of that afterwards, and Tracy does some wonderful things with that information, but it is a place for you to chat as well. Okay, all right. Ka pai, shall we get going, Tracy? This is how it's gonna roll out today. Right, we're gonna start with our long-term conditions, and there's about 9 groups in that session. So 9 groups of 2 minutes each. There's gonna be a lot of listening. So kia kaha, kia maia, kia manawa nui. Get whatever you need to do that. Then we'll go to maternity and child health. We'll go to cancer services, mental health and support, and we'll end today on community health. Kei te pai. So thank you, David. I see in the chat that you gave thanks for the karakia, the giving of the karakia, always important. Kia ora. First up, we've got the anxiety in the long-term conditions. So I'm going to read your name out as an organisation. Could you please just check in the reactions bar? I'm just checking that everyone is well orientated to Zoom. On the task bar at the bottom, you'll see a reactions button. It looks like a smiley face. You can see a wave, a thumbs up, a laugh, all those things. Along the bottom, you've got raise hand, right? It's got its own little task bar there. So when I read you out your organisation out, could you please raise your virtual hand, and then you will come to the top of the screen, and it will give us an indication also of who's not here and who is left to kōrero. Is that okay with everybody? Thank you for the real life nods. Ka pai. Okay, anxiety. Can we get you to raise your hand? Dementia Auckland. Diabetes Auckland, Duncan Foundation, Epilepsy Foundation, Heart Foundation, Hospice West Auckland, Stroke Foundation New Zealand, and Wilson Home Trust, please. If you raise your virtual hands there, beautiful. See, so we can get a visual on you. We can see who you are as well. And another thing is, if you wanted to, on your screen, you will see that there are 3 dots on your screen. If you wanted to click on those 3 dots, you also have the option to rename yourself and put your organizational name there. So that was for free, that tip. No, I'm just joking. Kapai? Okay, so it's all about, you know, knowing who you are and what you're doing in your space. So Kapai, who have we got from anxiety? Let me just have a look there. What about dementia? Oh, Judy Bately. What about Dementia Auckland? If you're from Dementia Auckland and you are here, can you come off mute, please? Kapai, what about Diabetes Auckland? Nicole? Nicola? No. Kapai, the Duncan Foundation. Kia ora, Julie. Tēnā koe. Welcome this morning. Oh, they're unable to mute themselves, Tracy. This is not, that's going to be hard to hear what you all have to say if you can't unmute yourselves. Ben, are you around?
We can now.
Okay.
Yep, here we go.
Excellent. So do we have someone from anxiety?
Yes, thank you for that. I'm still looking for the hand, I'm sorry.
Kia ora, Rebecca. Time over to you. Welcome.
Hello, I'm late today. I had a bit of technical difficulties. So do you want me to start?
Yes, Rebecca, you have 2 minutes.
Thank you.
And congratulations on getting in the room.
Thank you. So yes, a wee bit disorganised. Technology has a mind of its own sometimes, but so I'm Rebecca Irvine and I'm the area coordinator for West Auckland. I'm based in New Lynn, but I can go out as far as Kumeu, etc. I also do some work in Central Auckland for diabetes as well. So we've been in the process of expanding, as I've talked about in the last 2 meetings, and we're starting to achieve some groundwork now. So we've now got 2 meetings instead of 1 each month. And I have details of those meetings. I can put my details in the comment section for those that want to know about it. We're starting a walking group. We're also in the process of starting groups in Henderson for more accessibility to General West. And yes, so we come a long way. We also do presentations for community groups. So if any community group is willing to, you know, get some awareness on the ins and outs of diabetes in general, we're willing to do that. We're starting a welfare program, so if anyone needs any kind of advocacy or welfare, we've started that going as well, and I have details. We've got leaflets coming in that, they're in the middle of being printed. Also we have posters, and so we have come a long way, and we are still willing to work with other organisations, hence why I'd love to be here and hear about all you guys and what you guys are needing and doing, and I've made some good connections through the other meetings, so thank you, and I'll put the details in the comment section.
Thank you so much, Rebecca. A call out to connect. That's what I heard exactly. So,
Right.
Rebecca, thank you very much. Thank you very much. Do pop your details in the chat. Dementia Auckland, kia ora.
Kia ora. Hello, everybody. Good morning. My name is Nicola Brenton, and I am the key worker for Dementia Auckland for the West Auckland area. We are a service that provides information and support to families who are caring for someone with a dementia, as well as people living with a dementia. So we accept referrals from all of the usual sources, including families themselves. We provide one-on-one visiting. We have carer education courses to put families on. We're currently doing these in person as well as on Zoom. We've got a Living Well program. We've got walking groups to offer people living with dementia. We've got cognitive stimulation therapy groups, art groups, music groups, all sorts of things. And I facilitate support groups for family members, care partners, people who are living with someone with a dementia. We've got a great website, so go on to dementiaauckland.org.nz and you'll see a lot of our other programs as well. We've got dementia talks, masterclasses for any of you people or professionals who'd like to learn about dementia. So kia ora, lovely to see you all today.
Kia ora, Nicola. Thank you so much for that. Yeah, and absolutely share that link, the site. Yes, a lot going on, and it's lovely to see you again. Kia ora. Thank you so much. Papai. Nicola, so Diabetes Auckland, who did I see here from Diabetes Auckland? Who's here?
I've just done my presentation, and this is another one of us.
There isn't. So Duncan Foundation, kia ora, Rebecca.
It's Julie Rope speaking from Duncan Foundation. Morena, how are you?
Good, thank you.
Kia ora. So everybody, my name is Julie Rope. I'm a neurological physiotherapist and I'm here today representing the Duncan Foundation, which is a relatively new national support service for people with neuromuscular conditions. We cover conditions such as polio, inherited ataxias, dystonia, but I'm here today really to talk to you about a specific West Auckland Parkinson's project, which is in collaboration with the Bollard Charitable Trust. So we're working with people with recently diagnosed patients, who are those who've been diagnosed in the last 12 months. We're offering access to a fully funded intervention package with a neurological physiotherapist, clinically trained in Parkinson's, provided through the clinicians at Rope Neuro Rehab. We're really aiming to delay disease progression, facilitate positive health behaviours through exercise, and link, importantly, to community groups and provide educational resources to support their journey. And we have certainly found that there's a bit of a gap in the West Auckland referral pathways for people with Parkinson's. Clients must reside in the West Auckland region and have a confirmed diagnosis of Parkinson's within the last 12 months, but we offer no wait list. We can see you as soon as we get that diagnosis or that referral. And the referral pathway, I'll pop them through the chat, is through the Duncan Foundation website for registrations, or I'll give you an email address of the key therapist who's looking after this particular West Auckland recently diagnosed pathway program. How was that for 2 minutes fast?
Kia ora, Julie. Wow, you guys have really upped your game since our last meeting. This is amazing.
Well, we're new and we want you to all know about us and give us, enable access for patients with recently diagnosed. So I'll just put a brief summary in the chat for people to follow up with regards to referral pathways. We're super keen to access patients.
Yeah, how wonderful to hear too, Julie, that in your situation there is no waiting list. And
no
that
waiting list, absolutely.
You can respond. Yeah.
And the challenge of this project in particular is just that they need to be diagnosed within the last 12 months.
12 months.
So we want to capture them early on to have as much of an intervention impact as we can.
Thank you. Kia ora. Thank you, Julie.
My pleasure. Thank you.
Bye-bye. Epilepsy Foundation.
Kia ora. Good morning, everyone. My name's Lynn Williams and I'm from Epilepsy New Zealand. My job or my role is as an educator, and what we do is we educate and support parents, children and the wider family of anybody suffering from epilepsy, any form of epilepsy. One thing we try and do is we try and take the mystery out of it, because somebody getting a diagnosis of epilepsy is really, really frightened. So we can talk to them, excuse me, in pretty much layman's terms and put a lot of their fears at rest. We do a lot of education via schools, idea services and places like that, Spectrum Care, just to get the word out about epilepsy in the community, to take a bit of that anxiety around it. We do a lot of work in schools. with regard to supporting children. We have a Safer Schools seizure awareness program, which strives to be inclusive of children, all children with epilepsy in the community. We do a lot of awareness around Purple Day, which is an international celebration for epilepsy, just bringing it out to the community and do the fundraising. A lot of work, excuse me, we have a young adults support group. We attend social services meeting for families. We do transport to appointments for people, and what we also do is advocacy. So we can go into someone's workplace and we can explain and show videos and talk to them and come up with a plan for that person in their work area. We do total mobility cards, and sometimes we attend seizure clinics in the hospitals just to get a bit of a view over the patient, their actual seizure, which we can then take away and explain.
Okay, ka pai, so there you go. Thank you, Lynn, for that update, and anything else if you can put in the chat. Thank you. So that's what 2 minutes looks like and feels like. Kei te pai, everybody. Okay, kia ora. Thank you so much, Lynn. Heart Foundation. Kia ora, Rosalind.
Kia ora, bula. Hi everyone, really excited to meet you all. My name is Rose and I'm from Heart Foundation. Just started recently, so I'm one of the 3 heart health advocates for Auckland. I will be looking after counties Manukau, and my colleagues, one will be looking after North Shore Waitakere, Jennifer, and Ofu will be looking after Auckland. So yeah, just a little bit about what we do as heart health advocates. Our role is to get out in the community, raise the awareness around prevention and how to look after your hearts. Lots of cool resources on the Heart Foundation website, which I'll share the link in the chat below so you guys can have a look, and maybe order some free resources for your community if you want to. We've got an 0800 nurses line, so if you've come across any patients who have any queries around heart health, please feel free to share that number with them. All right.
Thank you, Rose. Thank you and welcome. Welcome to the West Side. Kia ora. And just put those details in the chat, yeah, with that link. Ka pai, thank you. Hospice, West Auckland, Hospice. Kia ora.
Kia ora tātou, my apologies, I was a little late, zooming from one thing to the next. Neat to see everybody. I just want to update, you know, we in the West and also the whole of the North Shore Waitemata DHBs, our hospices continue to provide care and support 24/7 for anybody aged over 18 with a non-curative illness. So we don't just look after people with cancer, we don't just look after older people, and so we're providing that community palliative care in that 24/7 sense. We're also really, really interested to work with you all as our community partners, Heart Foundation, MND, etc., around early identification of deterioration for people with a non-curative illness diagnosis, and our POI outreach services. Have people heard of POI? I see a few nods, I see a few no's. I really want to tell you all about it. And it's longer than the 2 minutes I've got here. So please get in touch with me because we would be very happy to come and talk with your organisation just around identifying early deterioration and how we can come alongside and support the patient and whānau journey from a Te Whare Tapawhā perspective with the resources that we have. I guess the other thing to say is hospice care is a funded service. We're not-for-profit organisations, and we work actively to ensure that access to palliative care is equitable, accessible and free across our community. So if you have the chance to shop at one of our hospice shops, that's what, you know, we're there fundraising to continue to provide the best palliative care that we can in our community. It's lovely to see you. E nohora.
Kia ora, Trish. Thank you very much for that update. And you've got a very capable colleague here who has just put all those details in the chat box for you. So awesome teamwork there, Hospice, West Auckland. Kia ora. Stroke Foundation. Did we hear from Stroke Foundation? Who's here this morning? Kia ora. Paula. Kia ora, Paula. Would you like to unmute yourself? Just on the taskbar at the bottom, on your left-hand side, there should be like a microphone icon.
Kia ora.
Kia ora, Paula.
Ko pulling toka ingoa. I work for the Stroke Foundation, which was first established over 40 years ago. The Stroke Foundation in New Zealand is the only national organisation which provides information, personalised, community-based services to people who've survived a stroke, as well as Whanau. They employ community stroke advisors, which I'm one of them, return to work advisors. We offer a vital range of free services throughout New Zealand. These services range from home visits, rehabilitation advice, workplace advocacy. We do referrals to health professionals all over New Zealand, and we help stroke survivors recover. The Stroke Foundation also employs a team of health promoters who travel the country. They work to prevent strokes by educating the public for recognising strokes and early signs of stroke. They administer free blood pressure checks throughout the community, throughout New Zealand now. The Stroke Foundation is closely affiliated to the stroke clubs throughout New Zealand. They run regular networking support groups and exercise classes, while also offering social activities and events to all its members. The Stroke Foundation of New Zealand's vision is a New Zealand where significant steps are taken to reduce the number of strokes and everyone understands and responds.
Kia ora. Kia ora, Paula. Thank you for that. We appreciate that and the vision, yeah, the vision of Stroke New Zealand, our Foundation New Zealand, lots going on. Kia ora, Wilson Home Trust. Ko Waitakere. Who's here from the Wilson Home Trust, please? Yeah.
Should be Felicity if she's here.
Felicity. Kia ora, Felicity. Are you in the house? In the room? Okay. No, not at the moment. So what we'll do is we'll just carry on. That's okay with everybody else. And if Felicity comes back in later, we'll see if we've got time for our Wilson Home. Hello? Hello?
Okay, I can hear you again now.
Yeah, sorry, I think I froze. Did I freeze?
Yeah.
Okay, you all didn't freeze, I did. Let's move right along to maternity and child health and Tipu Whanau Services. Are you here? Kia ora, I'm going to read these organisations out, and could you please raise your virtual hand so you go to the top of the screen and we get to see who you are. Tipu Whanau Services. Man Alive, I know you'll say is here, you'll say. Plunket New Zealand, please, are you in the house? Plunket New Zealand, great to have you here. Raise your virtual hand if you are, or use one of your icons, reactions. What about pregnancy help? Please. Ranjita, Kapai, thank you. So let's go with, I'm not sure if Tipu Area is here. So Man Alive, kia ora. Man Alive.
Unmute. Yeah. Hello. Good morning, everyone. I'm Jose from Man Alive. When I will tell you a little review. First of all, we are having clients face to face, and it could be by Zoom or by phone as well for counseling services. We have kids from 8 to 24 years old. The only requirement that we have is that they have to wear a mask if they want to have sessions face to face. That's it. At the moment is hold on the the Boys Alive program, that is an anger management program for kids from 8 to 12 years old because of COVID, but we expect to start on term number 3. So all the other programs, we have them here and they are individual sessions. So growing men is anger management 1-to-1, and youth general counseling is for any single issue, for example, being bullied, anxiety, depression, sexual abuse, etc., etc. All of those, it will be in that program. So that is mainly what I can say about our update and our services. Thank you very much, everyone.
Thank you, Jose, for that update. Kapai, do we have Plunket New Zealand in the house? Plunket New Zealand, who's here? That's not Ranjita?
Yep. Yeah,
it is. Ranjita, welcome.
Oh, kia ora.
Kia ora. Ranjita, welcome. You've got 2 minutes. The floor is yours.
All right, thank you very much. Well, I'm here. I've joined Plunket Whanau Fina as a new grade nurse, as a registered nurse last year, and we went into lockdown the same time. So I haven't had much sort of awareness or knowledge with what the community links or support services are available for the whānaus that I can connect them to, get them to engage with the services. So that's why I've asked my clinical lead if I could be or was able to join this korero, this session today, and I'm glad to be a part of this, and I'm just enjoying and making my notes with the different organizations in the community providing their support. So thank you very much. Thank you, Tracy.
Great to have you for the first time. Thank you for coming.
Thank you.
And Julia might be for pregnancy help.
Pregnancy help. Did I freeze again? Yeah, this is awkward. Thank you for your patience.
Laura. Julia or Laura?
Kapai. So not here at the moment, by the looks of it. Julia. Which means we're going to continue. Kia ora koutou. So we're up to cancer services and support. Is anyone here from the Bowel screening program, please? I can see. Who is here? Would you be able to raise your hand? Thank you. Kia ora, good morning. And we'd love to give you the time. Over to you.
Oh, Talawalawa Malolele, my name is Dini and I'm from the Bowel screening program. So I am one of the Pacific Health promoters over on this side. So the program is for people between the ages of 60 to 74 of age. Now we are testing for blood in the stool. I just wanted to let you guys all know that the program is available across all DHBs. So from counties, Auckland and Waitakere. You do the screening at home and you send it back to us. We also do transport. So if you've got like a patient who needs to have a colonoscopy and doesn't have a ride, you can give us a call. I'll put my number on the group chat and we can sort that out for them. So that won't be a barrier. We also have things translated in different languages, like the bowel prep, what a colonoscopy is. So that's in Chinese, Samoan, Tongan, Hindi. And what else can I say? Yeah, you can check out our website, which is Time to Screen, or you can give me a call on 021-943-808 if you have any questions, or you can just contact the 0800 number if you want to see, check up on a patient that needs a new test request. So that's 0800 924 432. I don't know how much time I've got left. I'm running out of breath. Yeah, it's nice to see everybody. I'll put my details on the chat.
Cindy, welcome, Cindy. You did really well. Congratulations. You got a lot out in a short time. Welcome to the space. Yeah, it's great to know. Whawhetai tele lava. Thank you so much. Yeah, great. Okay, so we're going to move on now from the Cancer Services and Support into, we've got 3 organisations today on our agenda in the area of community health for mental health and social services. So as I read your name out, please, as an organisation, could you raise your virtual hand so you go to the top and we all get to see you and we know who's going to speak. Salvation Army, please. If you're here, just raise your virtual hand or use the icons, the reactions. Healthwest, kia ora Healthwest, if you are here, please. Ka pai te puna manawa, kia ora. And te ata. Kei konei koutou, te ata, kia ora. Kia ora. So let's start with the Salvation Army. Who did we see there? Hawaii, is that? I actually didn't see Salvation Army come up. Is there anyone here before we would go to Te Puna Manawa? Oh, kia ora. I don't think there is from Salvation Army. Tracy, you recognising anyone?
No, it's meant to be Ange.
Okay, ka pai. Thank you. If Anne joins us, she can speak later if she joins us. Tēnā koe, Te Puna Manawa, Healthwest, kia ora.
Kia ora and talofa. My name is Ainsley. We have the only youth health hub in West Auckland. Provides a range of free health services across Waitamata, including Waitakere, North Shore and Rodney. Within our youth health hub services, we have a youth clinic, which includes nurses, general practitioners, youth workers, social workers, mental health clinicians and therapies, supporting young people from the ages of 12 to 24 and their families to manage complex health needs. Within that service, we also have a school-based health service, which is, again, free healthcare to all students, provided with a general practitioner support with nurses situated in the schools, secondary schools. Alternative educations and kura kaupapa Māori located throughout the West Auckland and North Auckland. We also have a youth young dads program, a parenting program for young dads from the age of 24 and under, referrals throughout general practitioner, youth health clinics, schools and other health providers. We also have a Healthy Babies, Healthy Futures programs for young mamas to provide health or, of hapu mamas, health information, education activities and physical activities, plus a text messaging service delivered through a telephone or a mobile. Again, self-referral and referrals through general practice, youth health clinics and other providers. We also have a Pacific Community Navigators program. These navigators work in the community and with other services to provide effective support, information, advice, and assistance to our Pacific and Māori communities, and also to connect these people and their family or whanau to services that will meet their needs. Last, we have a youth development program, a program that provides access to youth-friendly counsellors.
Ka pai, Ainsley. We just missed out on the last bit about the youth development and we'd love to hear about it. Please drop it in the chat. There's a lot happening. Wonderful to hear about this service, especially for rangatahi, especially for 12 to 24-year-olds. Amazing work. Thank you so much. Ka pai. Salvation Army, Healthwest, te ata. Who's here from te ata?
Should be Sue.
Okay.
Sue Harvey, but
yep.
I
Okay,
can't
that's
see her.
okay. If Sue's not here, that's okay. You know, we'll just carry on. Great. Okay, and so our last category, which will mean there will be time for those who come in who haven't had the opportunity, if we get through this in exactly the amount of time we have allocated for it. We're moving into community health. So as I read out your organisation, can you please raise your virtual hand or use your reaction button so we get to see all your amazingness at the top of the screen. Okay, Asha Services, Asian Family Services, Community Waitakere, Independent Living Service, Real World Living, St. John, the Asian Network Incorporated, and the Bowel Foundation. Thank you, everybody. Thank you, everybody. Ka pai. So, Asha Services, Ashwini.
Kia ora and namaste everyone. So my name is Ashwini and I'm a health promoter for Asha Services. Asha means hope in Hindi, and it is the South Asian arm for Asian Family Services, which is a support service for people, South Asian people living in New Zealand. And Asha provides free and confidential counseling service to anyone who is impacted by harmful gambling. This could include the person who's gambling himself, or like is affected by someone else's gambling. It could be like a family member, a friend, or even a work colleague. And alongside our counseling, we also focus quite largely on public health work to raise awareness about gambling harm, and to just provide the information that the help available through Asha Services. So our counselors speak in Hindi, Fiji Hindi, and English to provide culturally appropriate support for our South Asian population here in New Zealand. Counseling sessions are available face-to-face, by video, and also by phone. We also provide support, psychological support, and we are involved in a lot of social work. Currently, we're working together with MSD to provide financial support to people who are struggling with financial during their isolation period. So if you require any further information, you can always contact our South Asian helpline on our 0800 number, which I'll put down on the chat box. We are available from Monday to Friday from 8:30 to 5:30. Thank you.
Oh, thank you. Namaste, Ashwini. Lots of good work going on there. Hey, thank you very much. Thank you. And put those extra details in the chat box. Kia ora, is it Alex from Asian Family Services?
Yes, it's me. Yeah. Hello, everyone. Thank you, Ashwini, to introduce the Asha Services. Actually, Asha Services is part of Asian Family Services services. So I will introduce the rest of the services we provide. So firstly, we have the Asian helpline, just Ashwini mentioned. So when you press 6, it's speaking Hindi, but we also have other helplines. We speak 8 Asian languages. So we can provide emotional support on the line, and also we can provide some information for navigation to navigate people to different places. Like, it's good to know your services, and we can navigate people to you. And the second one, Ashwini mentioned a little bit, so we have the community connection services, which means we can provide food support and also the financial support to the people who are in isolation or who were in isolation. So when you identify people who are in financial difficulties and they have the financial, they are in or in isolation, you can refer the client to us, and we can provide the culturally appropriate food, of course, the halal food provided by Asha, and also the other Asian food. So another part I think quite relevant to all you guys. So we have the free counseling services. Apart from gambling, of course, we are funded by MOH. We are also funded to provide counseling sessions for the general issues. As long as people have the mental distress, you can refer the client to us. We can provide 3 to 5 counseling sessions to the people who are in need. And just like what I said, we have 8 Asian languages available. I mean, our duty counselors or counselor can speak those Asian languages, but we also have a DJ language support available. That is online interpreting services. So as long as the people who speaking other Asian languages, other than that, 8 languages, we can also using this kind of interpreting services for free to provide support. So I will just like list the referral pathways and my contact numbers on the chat windows. If you have any further questions, you can just contact us. And also you can be registered to using the online interpreting services. I mean the DJ language support, because it's funded by MOH. Currently it's free. So when you register with us, once you have people who need interpreting services, you can just using the platform to order free interpreters for you. I will include the website in the chat videos, and also if you have further questions, you can always email me. Thank you. Oh, it's very quick.
Wow, very quick. Yes, Alex, when you got it all in, congratulations. Thank you very much, Alex. I'm from Asian Family Services. Community Waitakere, do we actually have anybody here from Community Waitakere? I can't see anyone from this from where I'm sitting. So what about independent living services? Anybody?
Good day, everyone. Hi, good day. Joshua come from Independent Living. It's so nice and so honored to be here to meet a Waitakere House Link Zoom meeting for today. So Independent Living is not a for-profit organization. We are committed to making daily living easier for people with impairments as well as their families, Whanau, and the support network for sure. We are your family's community expert on all things related to the disability and maintaining independence. So from generic information through to walking stick testing, we can help you navigate the health and the disability sector and access funding options. We offer brochures and information in a wide variety of languages, and we sell a huge tried and tested range of the daily living aids, of course. Most importantly, we care about what people can do. We focus on abilities, we find solutions, and we work to understand the unique situation of everyone who comes to us. You will enjoy the caring advices and the expert of our team when you visit. Many of us has experienced disability of ourselves. So what we do has too deep personal meaning to us. We are all about helping our customer find your own path through life, stay in your side and on your side along the way. At the moment, Independent Living has 3 stores located in Royal York, Bronx Bay, and where's another one? Sorry, Royal York, Bronx Bay, and Botany Town Center. So we have an Asian team service too. When the Asian speaker customer came step into the shop, so the main job for us is to help them remove the language barrier, help them to find the proper way to support their independent living. Thank you, everyone.
Oh, where's Hinima gone? She popped off. Okay, I don't know where Hinima's gone, but
hello, Gilda.
Oh,
Gilda, I'm back.
Did you run away?
Thank you so much, Joshua. Thank you everybody for your patience too with the technology. I noticed I've frozen 3 times today. So thank you, Joshua. We are real world living. Is there? Oh yes, Robin.
Hi there, everyone. Hi, I'm Robin from Real World Living. We are a vocational and transitional service for people with disabilities over the age of 16. We are based in Papakura and Penrose, but our transition service covers the entire of Auckland, and that's for people leaving school and looking for what they will be doing when they leave. That's a part of what I do, but another part is also part of the Auckland Transition Collaboration Group. I've been part of it for 6 years, and it works with families, providers, and all education providers as well to work out what's working, what's not working in the disability sector and for families, because people don't always talk to each other and families don't know what is out there and how to get get services that they require. So we have an upcoming meeting on the 31st of May, next Tuesday from 10 till 12, and it is on Zoom. So I'll put the flyer in here as well, and you're more than welcome to attend. And it's open to anyone in Western Central Auckland. But even if you're not there and you can't attend the other areas, you're more than welcome to attend. And everybody gets an opportunity to speak and be able to network with each other. Thank you.
Awesome update. Is it Carolina from St. John? Carolina, welcome. Time over to you.
Thank you. Kia ora, ko Carolina Tokuinua, Community Engagement Coordinator for Auckland at St. John, New Zealand. And today I want to talk about our community health programs, just a quick brief about them. We have health shuttles services. Is free or COHA-based to take people to their medical appointments. It needs to be booked in advance. I can leave the details in the chat box. We also have Caring Color Friendship over the telephone service. It's for free for people who is in social isolation, maybe can benefit from having someone to check on them twice per week or something like that. We also have therapy pets, taking advantage of how pets can improve our mood and our well-being. So we also have that one. And we also have our volunteers in emergency departments and around hospitals. Maybe some of you can see them like around supporting and providing information, or even providing a cup of tea to people who is utilizing hospital services. We also have our community education, a lot of programs, mental health programs for rangatahi. Some of them are based in schools, ASB San John in schools. We also have early childhood modules. And we also have Poi Poi at Pitomata, a big spoke program 4 days of duration for free for community groups, for Hapu, Iwi, and any group that maybe have a group of 20 young people from 14 to 20 years old. Please feel free to reach out so I can provide you more information. It's a really cool program, and it also includes a level 1 first aid course. So it's really, really good for our young people. And finally, we have 3 Steps for Life, a community awareness session that talks about how to call 111, how to call for an ambulance, how to do CPR, and how to use the defibrillator in case that's needed. It's for free, and every community group can access to it. So also feel free to reach out. And we finally have our area committees, local groups of volunteers that are now getting in touch with communities and getting to develop new community health initiatives. So if
Okay, I think Hanima's frozen again. And I think Samuel Cho from the Asian network, I don't think I've seen him here yet. Samuel, are you here? Calling Samuel. So we'll go on to the Bowel Foundation, which I know is here. I've seen Tim. There you go, Tim.
Great, thanks, Tracy. Kia ora tātou. I'm Tim Evans from Bowel Foundation, and so we are the official charity of one of the DHBs, so that includes Waitakere Hospital, and that's obviously the focus of today's update. And I did just want to update on a couple of key projects that really are going to benefit the community in the coming months and years. And it might actually be helpful if I just share my screen just so that I can put some images with it. Don't worry, I'm still mindful of the 2 minutes. Can you see that? Great. So the first is the Waitakere Hospital Special Care Baby Unit. So many of you will be aware that this has been in development for a number of years. It's actually only been made possible because of $5 million being gifted by the community through Bowel Foundation for this project. And the DHB's made obviously it was close to a $5 million contribution as well in the end. But it's at a really exciting stage. So the images here were taken just a week or so ago. You can see that it's just an amazing space. They're in the process of fitting it out with furniture. It's more than doubled the footprint of the previous special care baby unit. On the bottom right-hand side there, the pavilion and the mother's space. So they are both overnight facilities with en suites, basically like a hotel room for families to look after their bubs while they're in the unit. Everybody that's been through it is just blown away by the world-class feel of the facility. It goes from 12 care bays to 15 initially, but potentially up to 18 over time as well. So this is going to open, it's all on track to open from June 29th. So very, very close. We're going to have launches. Ministry of Health is going to come and open it in the month of June. So just wanted to update you on that exciting development. And then secondly, I've talked previously with this group about the Waitakere Hospital Special Care, lost my screen there, primary birthing unit. So you'll recall that this is about providing a space for mothers and bubs and families that isn't a hospital environment for giving birth, that it provides a midwife-led non-hospital environment, which we know from the evidence improves outcomes. And we've got this block of land in the bottom right there that's been set aside for it, which would have its own entry into Busker Ave. And we've got the initial design work, the preliminary design work done, but it needed approval from Ministry of Health and Health New Zealand, given the transition. That approval we're still awaiting for that to go through process. May or may not happen, but we'll know more in the coming months as Health New Zealand comes on stream. But in the meantime, the DHB is in the process of approving the next chunk of design costs that would allow it to get through to detailed design, resource consent, which means that the project isn't going to be held up by the approval process. So just wanted to let you know that that has been unlocked. The DHB has been a massive advocate of this project. Judy, the board chair, has really gone into bat for it. David Louis on the Audit and Finance Committee, and he was part of approving this next stage. So just wanted to let you know that there's a lot of people wanting to make this happen, and it's still very much moving along.
I let you have more than 2 minutes because I think this is very exciting and everyone wants to see and hear about all this development going on in our local hospital. There is an upgrade or refurbishment of the foyer going on as well. And do you know anything about that one, Tim?
There's actually a meeting happening this week.
Yeah, so you haven't got really any pictures to share or anything, have we? Yeah.
No, after this meeting this week, I think.
Yeah, maybe at the next meeting, we might have some visuals to share. So anyway, so that's good to know that that's moving along as well. So we've got quite a few things moving along and in the West, which is exciting. Hemo has been messaging me. She's completely locked out now. I don't know whether she'll be back or not. Anyway, I think there's a couple of people that have turned up. I know Pregnancy Help that missed out on their time. Are you here, Julia? Yo. Pregnancy Help, would you like to do your 2 minutes because you missed out on your section?
Yep. I'm Laura here. Hi.
Off you go.
Can you hear me?
Sure can.
We can, right? Okay, Julie, you want to do it? Yeah. Okay, Pregnancy Help offers free and confidential counsel and practical support to pregnant women and the Whanaus. And our free services are maternity, nursing way, baby clothing up to 18 months. We give them a layer of baby clothing, all pre-loved but well selected. And then we have bassinet, but we loan out the bassinet with a little bit of small deposit just to make sure that it's returned to us. And when it's returned in good condition, we will pay back the deposits. And we have also got blankets and baby gears like bathtubs as and when it's donated to us. All our stuff here are donated except for the bassinets, we buy them. Okay, and we have 2 outreach centers, one in Blockhouse Bay. It's once a week, manned by a volunteer once a week. It's more for collection and drop off for people out in the West for their convenience. Donors and clients that find it difficult to come to this city. And we have another one in Otara, and it's open once a week as well on a Thursday. And it's half a day from 9 to 12 and by appointment. So these outreach centers will be collecting and drop-off points for donors as well as for clients. And our office here in Panel is manned by our 2 of us. I'm the coordinator, and we've got Julia as the clothing manager and logistic manager. And it's open, office here is open from Monday to Friday from 9 to 3:30. We have 2 car parks that the clients can come and see us and collect their things. We also have a scanner in our room, in one of the rooms, that we are happy to let midwives or anybody who wants.
Over to you, Hanimoa. You're back.
Okay, thank you. Can you all hear me okay?
Okay, and I am on my phone, so we're getting down in the line of options, all right? But I am here, so I am zooming in from my phone. Thank you for your patience. Right, so I'm assuming that we are down the list and we're almost nearly to Tim, who is the Well Foundation. Are we almost nearly there, Tracy? Who's next?
No, we've done Tim. He
Tim,
shared all of, yeah.
Tim usually goes last, don't you, Tim?
Yeah.
And we end on that good note. Kapai, so where are we at now?
So we've had pregnancy help that zoomed in late.
Great,
and
thank
maybe
you.
just see if there's anybody else that was that wasn't here during the time, or we'll have time for ME Auckland or Changing Minds if they're here.
Kapai. So if you are here, because I'm on the phone, I cannot see the whole screen. So if you are here, could you put your hand up and Tracy will be able to see whether you are in the room. And we're going to wait 5, 4, 3, 2, 1. Kapai. So is there time actually now? Would you like to move on, Tracy, to sharing the petition?
Yep.
Great.
So, Benjamin, can you share that petition PDF, please? Right. So, I think last time we had our meeting, we all agreed that we would start this petition. We now have over 5,000 signatures, and we are still waiting on a public meeting date with Andrew Little to present this petition to him. We are planning to co-host a public meeting with Phil Twyford's office, who was going to get Andrew Little and the new Health New Zealand CEOs and things like that to join in a sort of panel discussion. So we're still going to bring that to you. I can't see that it's going to be before the end of June now, but meanwhile we'll be collecting more signatures for the petition. So so if you can still share this petition, we're happy to send you hard copies that you can get people to sign if they don't have a smartphone and links and things like that on the computer. David, how many have you got on your hard copies so far? I forgot to ask at the meeting the other day.
Yes.
David Louie.
Kia ora, David.
Past 500 at the moment, probably close to 1,000.
Ooh, that's exciting. Yeah, so we're hoping, you know, maybe we'll be to 10,000 by the time we get our public meeting date, but please keep sharing it. And it's not a futile signature. We are planning to take it somewhere, and we need to get the attention of the minister to ensure that, you know, all those great things that Tim's been talking about sharing with the primary birthing unit, that needs to be signed off by the new ministry. And, you know, finishing the SCABoo, we've got the foyer, and, you know, we've got lots of things that are on the horizon for this hospital. I also just wanted to remind you about our video library we've got on our website now. I've got a couple more. We've got about 10 now. So if you wanted to do a little 2-minute, like you've done here, that we can upload to our website, we're starting to develop that. Probably, you know, we could do with a few more. There's about 10 so far. So it'd be really good if you know, if you just did a selfie video, that's as good as it needs to be. It doesn't have to be professional. And so, yeah, so keep that in mind and send those along. Back to you. That's all my updates, really.
Great.
You, are you still there on your phone?
Can you hear me? I am still here. Great. Thank you. Thank you for your patience. I keep saying that, but I really mean it. Great. So actually, that is really the majority of our agenda. And it is, you know, all about giving you space and time to connect with each other, to see each other's faces, to hear more. Please take the opportunity, if you can, to link into the video library. You know, that's something there that you can also continue to share. And I think that's about it. I'd just like to check in, Tracy, just before, you know, because if we're through the agenda, potentially we'll close the meeting. Is there anything else that you can think of? I'm just thinking of our Waitakere HealthLink board, Tracy. Is there anything?
Well, I was thinking that David Louis might, I'm putting you on the spot a bit again, David, but is there anything you'd like to update the NGOs on through what your information you have through the Waitakere District Health Board, being a board member on there, that you might update that could help the NGOs in moving into July, because we really haven't got any information yet.
Thank you.
Hello.
Thank you for the opportunity, Tracy. Can you hear me?
Yep.
Yeah, as most of you might know, you know, we've got one more meeting before the DHB is actually disbanded. But in leading up to that, there's been a few opportunities and meetings that I've been part of with the transition, and also with the chair of the Health New Zealand. And as mentioned earlier, a panel discussion is going to be organised out here in the West, which was going to happen this month, but it will probably be after June. What I can say as a member of the board representing community and consumers is that Health New Zealand is very keen to ensure that the voice of the people is very much heard. While the details of how that will happen has yet to materialise, I think it's I'm confident and that they're very sincere about that. What is important in my contributions to these forums that I go to is that it's really important that you're actually connected to the voice of the people, and therefore I thank you, because these are the sort of forums that informs a lot of the opinions and that I present to Health New Zealand, or to the District Health Board, or to the regional meetings that I go to. So just really grateful this morning as well to hear all of your kōrero and all of the services that you provide, because that helps to inform people like myself and Waitakere HealthLink, who are there to advocate and speak on behalf of our communities here in West Auckland. So yeah, as we are preparing to shut the door on the District Health Board, but I'm sure there will be other opportunities where our voice will be heard in the new organisation that's going to be in place. Thank you.
Judy has a question.
My comments are, it's a question and a comment, and thank you so much to everyone. Thank you, David, for your comments. Thank you to everyone who's contributed. It's just wonderful to see how much is happening out in the community. I'm speaking because I'm a member of this group, but I also happen to be a director of Comprehensive Care, PHO. And I think PHOs aren't mentioned in this conversation, in this kōrero. And I think that the important thing is that the GPs need to be aware of the vibrant community groups that are out there, because otherwise they're not going to refer people to you. And so to me, there's a missing link happening here. And I do think that we need to try and get together and get that information flowing in a much more accessible way to people who are likely to refer patients your way, because I think that that's very much the way within the locality planning that they envisage how we're going to move forward, that having those links is really, really important. So yeah, thanks.
I totally agree, Judy. It's I've been advertising and inviting the GPs. I've got all of them on our database for all of West Auckland And I think I got a couple along to one of the open days in the foyer, but otherwise they don't seem to be, you know, put this as a priority, which is really disappointing. But, you know, if you've got any ideas on how we might sell it to them, that, you know, an hour and a half sitting on this Zoom will be worth their while, you know, please share.
Yeah, so that to me is the difficulty, because they're time poor at the moment. They're absolutely flat out dealing with COVID. And I think we need to look at enhancing and using digital, you know, opportunities to develop that. But let me tell you that, in fact, I also co-chair a clinical advisory group for the PHO. And, you know, basically I've reached out and we've had Laurel George come and talk about the health consumer panel for the DHB. And really, you know, the next step along the way to me is actually getting you, Tracy, to come, and somebody else, if you want to come along and actually do a presentation to that clinical advisory group, because it's about strengthening community voice into primary care. Yeah.
Yeah. Absolutely take that point on board, Judy. We absolutely agree with you, because it's really needed. We need to have all the parts communicate to each other in a cohesive way, not just you know, from the community, from the DHB, PHO, etc. So there's a lot of moving parts that all need to come together. So it's a real challenge for Health New Zealand to bring all those parts together in a very short period of time.
Kia ora. Ka pai, kia ora, good kōrero, good discussion, some ideas, some maybe picked up for action. Kia ora, Tracy, checking in with you.
Yep, Trisha's got her hand up because I know you can't see it because you're on.
I cannot. Thank you.
Thank you, everybody. And thanks, Judy. Look, I think, you know, and I've seen the comments coming through in the chat, Judy, that as NGO and community health providers, a lot of us experience some difficulties engaging with general practice at PHO and at local level. And so, you know, it does concern us that our services are not being accessed for people as they could be if there was a greater awareness. So I guess we'd be very interested to know what the strategy, what the solutions could look like from your user end, because, you know, we do put quite a lot of energy into this engagement.
Okay.
Yes, when Healthwest was a PHO and I had some part in helping to organise the College Points meetings, every year I made sure that there was one that I invited all the local NGOs to, and the doctors were blown away by what they didn't know that there was. So that would be a really good thing if the PHOs would be able to include an evening like that for their College Points.
Kia ora. So I'm just coming in at this point, Tracy, because I think you're the one that can see everybody. And I'd like it if you could actually say, if there are hands up, who will speak next?
Okay, so no more hands up. Back to you now, Honeyma.
Kia ora. Thank you very much. So on that note, thank you. I think that was Kay. Thank you, Kay. Kia ora. I am actually going to acknowledge everybody for the time that you've taken out. And you know what? Actually, to end on these kind of questions is how do we get better, right? And engaging the community voice in our services and getting people to the services that are available. I think that is important, that we end these kind of hui on those challenging questions for ourselves, recognizing the work that we're each doing in our own area, and that how important those relationships are if they're not present, or the gaps that exist. For one of the beautiful kōrero I heard about our healthy babies and healthy mamas, you know, and healthy families. So ngā mihi nui kia koutou, Tracy. I am going to end our hui at this stage at 11:11. I can see it is. It is a bit early. Please, just picking up on that point, if you can send a video, you know, that is one kind of digital approach
just one. But if you can, that call out from Tracy to go up on the website. Tēnā koutou katoa. Thank you, David, for the update. And I will close our meeting now, if that's okay with everybody. Me inoi tātou, kia tātou katoa, te atawhai o tō tātou ariki ai hukaraiti, me te aroha o te atua, me te whiwhinga tahitanga ki te wairua tapu, ake, amene. Kia ora everybody, thank you so much for your time. Kia ora.
Thank you.
Thank you. Have a great day.
Thank you very much, everyone.
Thank you so much, everybody.
Tracy,
Kia ora.
Tracy, can I catch up with you for 5 minutes?
Yep.
Oh, excellent. I just want to check with something with you.
Yep.